Good afternoon. Apologize for being a couple minutes late. Usually I think we start about 3:06, right, Andrew? I think we might have went past that. Sad day. We lost President Dennis DePiro in the community of St. Bonaventures, previously of Lemoyne College, Onondaga County resident with his family. Certainly think about Dennis and his contributions to many of us over the years, and I want to keep him and his thoughts and his family in our thoughts and prayers. Positive 7-day rolling average, 0.9. Same with our 14-day average. I think it's at 1%. So overall, I think when you look at where we are as far as positive rate in really cases in the community, we've started to stabilize at a very low rate. If you consider everything that we're still indoors, there's still snow going, a lot of wind outside. Overall, we have now had 31,614 positive cases in Onondaga County. That's 73 new cases. Out of the new cases for the last 2 days, wanted to look for a couple trends to see. I haven't been getting these often, but I asked Dr. Gupta specifically, over 65. Why do we ask over 65? Is because we're vaccinating over 65. Out of the last 2 days, we've only had 4.3% of our cases. One of the things I was concerned about before February break, looks like the data is showing it to be true, that we would get a little bump from travel. 16.4% of our cases over the last 2 days have been travel-related. Household contacts, 24%. That continues to show how strong the virus is, that essentially if someone in your household gets it, you are likely to get it as well, unless you are very good at distancing in isolation. Higher ed, 19%. That's not just local colleges. It's college students that may get the virus but isolate in Onondaga County at home. So those are a couple trends, right? Caseloads have been stable between 50 and 100 cases really for the last 2 weeks. It's important that when we look at these things, in that range, we've absorbed higher education cases. We know that that's going to happen because we know that these young people are socializing, even when they socialize with precautions and whatnot, you'll still have higher risk. Household contacts are a higher percentage. That's probably because you have lower caseloads themselves. But again, household contacts are better cases to have because these folks are in isolation or in quarantine already, so the risk to the community is less. Travel being something that's new, we'll have to watch that, but certainly it makes sense. People go away to Florida. We all know people that went to Florida over February break. They come back, other parts of the country where the positive rates are higher, a lot of them are going to come back with COVID, so it's important that any symptoms we test. So that's a little breakdown of what we're seeing there. Hospital, 56 residents in the hospital. We've continued to see hospitalization rates each week drop. Overall hospital capacity outside of just COVID is in a good spot. I think my report had about 1,070 people in the hospital. Normally you have 1,700 beds, so that's a good spot. That's about, since we've been watching that stat, that's in the lower range. 7 of our neighbors are in the ICU. Please keep them in your thoughts and prayers so they can get well and get home to their families. Vaccination front, we've had busy weekend working with our partners in the state. Today we're vaccinating 800 people, first dose clinic upstairs. We received our allotment from the state this week. We will be receiving more vaccine this week than we have in a period of time. So I've been pleading with everybody to give us more supply. They have listened. We'll be receiving 6,685 doses this week. So we'll come out with a schedule. What this will mean is we will be able to micro-target some of the categories we've been working on and hopefully finish them up. In addition to that, we will have more vaccine for our seniors. We will start working with Restaurant workers have been going to the fairgrounds site. We have worked with various restaurant associations to get names, almost like a pre-registration. We'll start vaccinating off of that list, and then we will open up slots to the community when the supply gets here. But each week we've been intentional. We've been intentional with pop-up clinics. We've been intentional working with members of the refugee and New American community, credible messengers, to get them over here to the On Center. We'll try to close out education staff this week and next week. We've done a really good job with, and I want to thank the various representatives from the teachers unions and the school districts of identifying employees who didn't have appointments. Now we'll even talk to them about who has appointments in late April, in April, and maybe try to get them in earlier so that we can get through that category of employees. So that's exciting. We've been working off of 1,800 vaccines a week, plus a pop-up clinic here or there. Now we're going to 6,685. Essentially, when that comes to second clinics, if we can stay at this supply, that means really we're at 13,500 of weekly supply. Once things get ramped up, on-center capacity-wise, 18,000. So then once we get through that, and this facility would be at capacity, then we look at other distribution partners and other distribution sites here locally. So progress. We will go by, we will actually crush at this rate. This week we'll get through, I think we were over 92,000 first doses going into today. We'll get through 100,000 very easily this week. We'll probably get close to 110,000 by the end of the week. So things are starting to really move forward on the vaccination front. I feel like we're playing offense right now in this pandemic, so we're very pleased with that. Looking at testing, I can't say this enough now. We really believe that our biggest risk for uptick in cases now is symptomatic spread. So please, if you have any symptoms, please get tested. This is how we'll continue to keep things going in the right direction. Again, ongov.net/Cayuga Medical, Monday through Friday, 9 to 1 at the F Shed. There is plenty of appointments. Please take advantage of that. Again, we'll continue to do our community testing program where we're testing in schools, where we're testing at community sites throughout the county, and certainly here at the On Center. So please take advantage of that as well. COVID19.ongov.net. Today, for example, we're at the East Syracuse Village Hall. I think we're testing upstairs as well. And I believe we have some school testing going on today as well. So we'll put out that data later. But testing is what I believe firmly, identifying the virus quickly, isolating it. It's put us in a position to have a lot of success. If you look at our 7-day average compared to our peers who are around our size or larger, we're in a better position than the rest of the counties in New York State. So it's really, we've had a lot of success with the strategy, and this is what we need to continue to do moving forward. You know, there's probably some other topics you want to talk about, so I guess I'll open it up to questions.
Will you be receiving any Johnson & Johnson vaccines? Do you know about that yet?
So I don't know if we will this week. I know the state of New York will receive Johnson & Johnson at some point. Again, if you look at if they're getting it Wednesday or Thursday, it will probably be in next week's vaccine plan. But again, I think they're receiving about 170,000, maybe a little bit more. So depending on how they distribute it by region, even if we don't get it ourselves, our region will see some of it. I hope we get some, because that will be a very good tool for us to go to our homeless population, to go to homebound seniors. That one shot is where you want to use for your populations that you don't know if you're going to get heavy participation with the second shot. So hopefully it gets sent to the local health departments because we're closest to the people. But regardless, if the state gets 170, New York City is going to get half that. The rest of us will split that up. Our region will receive Johnson & Johnson at some point in the next week and a half. Whether it's at the fairgrounds or through us, we'll see.
Is the state given guidance as to how they're allocating Johnson & Johnson's supply?
We haven't seen any of it. The state just found out they're getting it last night for this week.
So you're getting 6685 doses tomorrow?
We don't know when we're going to get it, Tim. We're going to get, right now, 2,500 of that's going to be Moderna. The rest will be Pfizer. So we thought we might get some Moderna today. We didn't. So my guess is we get the Moderna tomorrow. And then I believe we have to pick up the Pfizer at one location, and I think the other location is being shipped to us. So, but we plan on having clinics Wednesday, Thursday, Friday, Monday, Tuesday. So we're going to be in a position where we were in the beginning of this vaccination process, right? So we're going to be, a vaccine week is a Wednesday to Wednesday. We're now going to be vaccinating at least through the weekdays, the 5 weekdays. And then certainly if we get more supply, which I'm pretty aggressively asking for, then we'll probably have a Saturday clinic as well. And then if we even get more, then we look at a Sunday clinic.
And so how do we get from that level to, you talked about 13,000 a week?
Because eventually we're going to be doing second shots for the same supply. So we know a lot of it's Pfizer, so a lot of it's Moderna. The Pfizer, 2,500 Moderna, the rest of it's Pfizer. So do the math, it's almost 4,000 doses of Pfizer.
So how quickly do you think you would need possibly a second site?
Not till we get to 18,000 here. But what we'll start doing, Tim, is we'll start, as we get more local distribution, we'll really be able to control our own destiny with micro-targeting into communities that are just certainly not participating in the mass sites. We are going to do a pop-up clinic at some point this week. We'll figure that out and talk about that. But we'll look, once we have more supply, you can do more things. People email me all the time, what about this, what about that, I have an idea here. It's not that we don't have the same ideas that people have to get it, it's just we haven't had enough supply, right? It's all about speed when you're in the middle of the pandemic. And, you know, it almost doesn't matter whose arm you are from an epidemiology perspective. It's about shots in arms. So the right method of distribution to crush the virus is the mass vaccination sites. The challenge we have is certain communities don't participate as much. We know that now. So now we need to go there. Now that we have more supply, we can dedicate more each week to those communities.
When you do the pop-up clinics out at neighborhood sites, do you have to limit it to the phase 1A and 1B?
We do.
You do.
We do.
Is the 6685 the most 1 week supply the county's gotten yet?
Directly, yeah. We've had redirected supply in the beginning from hospitals, plus we were getting 3,600. So we might have been close to that number for a week or two. But yeah, this is a big turn for us. It's we're, you know, the number over 65. If you look at the new case number, that's a great number, right? I think 4%. It's going to continue to go down as our seniors get vaccinated, and that means our hospital numbers are going to go down. Because there's the direct correlation over 65 to the hospital with this virus, or residents who have comorbidities to the hospital. So the promising data points all around, and it just gives us the ability. So there's going to be, in addition to that, you're going to have 3,600 appointments available for pharmacies this week, right? There's a lot of pharmacies getting supply. And then the state site, which we help staff at the fairgrounds, has a lot of supply. So there's going to be a lot of people vaccinated this week.
You mentioned a continued push to get the community to come out and get tested for COVID-19. Are you seeing fewer people right now coming out to get a test? And if so, why do you think that is?
Well, I think there are fewer people, partially because there's fewer people with symptoms. And that's what really drives people to get a test. We just think it's smart, and I think at some point we'll see test numbers like we never have before, because conditions for economic activity, when you think about every wedding's going to need to be tested and whatnot, will blow the roof off test numbers. When we have the testing we have now, and then the colleges come back, you know, when we have a baseline 5,000, 6,000 tests in the community and the colleges come back and they're testing, we get really heavy testing numbers too. But I think having less symptomatic demand is a good thing. What I'm concerned about is the folks that do travel, that they really, you know, there's an honor system here, is that you really do test out of the quarantine, or you quarantine for the full 10 days. That's important when we're doing this. And are you, if you aren't doing that, are you the same person that's beating me up about opening up this or opening up that? Well, if you're not doing your role, then it hurts the whole system and the whole community effort. So symptomatic spread put us on a trajectory to where we were seeing an uptick in cases before Halloween, and then things kind of took off from there. So I think we're on the downward trajectory. I don't think we're gonna, you know, I think until the weather gets better, I don't think we'll get out of this range. I think this will be where we are. But then what's the risk? The risk is that people start to get it again from travel. They come in and then they're not getting tested to break that cycle.
You alluded to new education guidelines, and knowing your briefing schedule, that could have been Monday or Thursday, unless you wanted to surprise us in between. Wondering what the status of that work is in the health department.
Yeah, so Dr. Gupta and her team are doing a lot of work, gathering data, communicating with all the partners. I expect to have some sort of recommendation from Dr. Gupta this week.
That could contain specific distance school changes.
Yeah, that's really what we're looking at, right? That's what we've been asked to look at. That's what, again, in the beginning of the year, if the districts decided they were going to have their desks at 3 feet apart with partitions, they could have. They didn't. Why didn't they then? Let's rewind where everybody's head was then. Everybody was saying there's no way my 6-year-old's going to wear a mask, or my 8-year-old or my 10-year-old. Reality is the kids are much better at wearing masks than the adults, and they have. So to avoid that, the rule was then you need to be 6 feet apart, just like physically distancing rules in the public. If you're within 6 feet, you need to wear a mask. So that's where they were way back when the plans were approved. So now to modify the plan, then you need the public health department to say it's safe enough to do that. And so that's what Dr. Gupta is looking at it. She'll have a recommendation, potential guidance, depending on which way the recommendation goes, and then you know, we'll see what the recommendation is, and then the school districts have decisions to make.
When should people expect that information?
This week.
Shifting from schools to colleges, you mentioned that the county has absorbed those higher ed cases. Has the most immediate and largest concern passed there?
Yeah, I think overall you know, it's kind of one of those things where you know that there's going to be cases there with the under 35 demographic. It's just the negatives of that is that there's still COVID there and people can get very sick. The positives are the historical data shows you that in those demographics, folks don't get as sick typically. That doesn't mean somebody can't have a horrible outcome. They can. So I think it's just when we're all done with this, when we're done vaccinating, there's still going to be COVID cases. We're still going to have COVID-19 here for a period of time. And so COVID's not going to go to zero. It will just be that it's no longer a pandemic. And so I think it's something we just have to learn to live with. The college themselves, what will happen is you'll have the occasional cases, right? You'll have your occasional cases, but then you'll have a spike when you have a party where there's 80 people together and, you know, somebody there has COVID, right? So then that's kind of, those are the risks that higher ed usually brings to the table.
Speaking of parties, do you have any update on that big SU athlete party from a few weeks ago?
I don't, yeah.
What about in terms of students and fans back in the building? I think it was 2 weeks ago, you said that today might be the day.
Yeah.
That there might be students back in the building. I think you tweeted over the weekend that you're pushing the state to approve the plan. Do you think at this point that the state is essentially delaying their own decision until after basketball season ends?
No, I don't think there's any intention with it. I think the state is struggling with Syracuse University's lab. Syracuse University has how this works is they have a lab. They have an FDA Yale-approved surveillance test. They do a test, If you become positive on that surveillance, they then give you a PCR test. So you get 2 tests. And then if you're positive there, then you're in isolation, right? So I don't know why that protocol doesn't work. If it's okay to work for the public, why it doesn't work for a basketball game or a lacrosse game. So that's the holdup, is the state needs to approve the testing program at Syracuse University. That testing program is used every day. It's worked very well. So I'm pushing the state to, let's figure out how you can say yes on this. We're okay with this testing protocol every day of the year, but now all of a sudden we have a problem for them to get fans in the building. It makes no sense.
Just to make sure I understand this, the university tells students when they take these COVID-19 tests that they don't classify, they don't say for sure whether or not that you have the virus. You're saying they're similar.
It's a surveillance test, right? So and then there's going to be one of those surveillance tests is going to, if it comes back with a positive, you then test everybody a second time within the surveillance. That's a good protocol. Why it's okay outside of entering the stadium and then it's not okay to enter the stadium makes no sense. So I'll continue to try to work with both parties to find a resolution. And any way we can be helpful, I've offered to all partners, if there's a way that the county can be helpful, let us know. I think at this point it's kind of just, it makes 0 sense to me.
Right now, the state is requiring a PCR test.
Yeah, so the challenge with, again, this is going to be a challenge for every event. So the PCR asymptomatic test costs money. So why I thought Syracuse University was going to be able to do this better than everybody else is because they built their own lab. And so they invested the money. So their cost to do a surveillance test is, say, $5. So they can eat $5 or they can get $5. Somebody will pay $5, right? If you have to pay $50 or $100 plus a ticket price, you are then limiting who can go to the game. There's only so many people that can then afford that ticket price. So that model has to get changed. We have to be comfortable, or we have to look at different rules on how to get people in. So if you, I'm going to work with the state and Syracuse University to try to get through this for fans. It makes 0 sense to me on that. But the model overall, most rapid tests are antigen tests. So how does this impact the county? If we want to go have a concert later on at the amphitheater, and I have people who, 10,000 people want to pay tickets, they've all been vaccinated, and they all take an antigen test, and they're all negative, like, I don't know how much better you can get, right? And so I think we just got to think through the testing requirements with some of the reopening here. And again, if we're okay with surveillance, anything in the pool shows a positive, then we go in
Those
PC.
are saliva tests that SU
Yes.
doing?
Yeah, and then if you get a positive, though, you go get a PCR test, right? If that's okay every day of the week,
Right.
why isn't it okay now?
What are we going to use for weddings? Those are going to open up in a couple weeks.
Most of them will be antigen rapid tests, will be my understanding.
And that's acceptable for 150
I think so.
people at a wedding?
I think that's the guidance right now. I'm not an expert at the wedding guidance. I haven't been able to read through it all yet.
The county won't be involved in like assisting with those or monitoring those?
We will be. The guidance, I think, just came out, Tim. I think there's going to be there is a role for local health departments. Exactly what that is, I haven't been briefed on it yet. But again, with rapid tests, I do know that the state's interested in rapid test sites potentially, and we've given them some sites to look at.
Just to put a wrap on the dome discussion, the final home game is this Wednesday. You anticipate any changes before that?
I've been pushing. I'm frustrated that there's not fans today versus Carolina. So we'll continue to push. I had conversations with the university earlier today. I had conversations with the state on Friday. This is unnecessary anxiety when you look at everything else we're dealing with.
Is it simply the state has to decide per location if it's allowed? Is that
They have to
what
be
the-
comfortable with the test.
Is that the weight though, right there, that the state isn't comfortable with SU's test?
Correct.
How come, I
mean, I know you just said this makes zero sense, but like, how come that they say it's okay for students who live in congregate living dorms and go to class and eat inside different buildings? Like, how come they say it's okay for that?
I don't know.
At least one Republican county executive has called on the governor to resign. How do you feel about that?
I think that the proper investigation into credible claims is started with the referral to the Attorney General, and certainly I believe the claims to be credible. An independent investigation is merited, and I think that process has started.
So you've read the accusations from both women who have come forward
Correct.
with their stories,
Correct.
and you believe them?
I believe they to be credible enough that an independent investigation is merited, yes.
Do you believe the statement so far, I believe the most recent one was yesterday from the governor, was an apology? Did it do enough? Did it suffice so far for what he's been accused of doing?
Yeah, that's not my role to say if he went far enough. I think there's two people that can answer that question. It's certainly not me.
On restaurant workers, I know that you've been working with by law to get a list of restaurant workers in the county that possibly they could start receiving vaccinations this month. Do you have any update there?
Yep. So we'll start working through with this supply that came in now. We'll start working through some of those lists that Bud provided.
So that's to say that restaurant workers could start receiving vaccinations.
Yeah. So we're not going to just open up the floodgates, right? So, but we're going to target each week a percentage to go there. Again, other restaurant workers certainly can go and go to the state fair site, but we're going to work off each week now a certain number of slots at our pod will go to restaurant workers, and hotel workers were just put on county, same situation. We can say yes, and then they can go. We work with the hotel industry very closely. Normally, we fund Visit Syracuse and the convention center and everything where we are. So we're going to work with the hotel owners and the representatives of the unions to, again, form pre-registration lists so we know how many employees there are, and then we can work those into our plan too. But again, comorbidities, working through seniors, obviously, most of the supply will go to those two groups, but we certainly have more supply so we can do more.
Do you have a date for vaccine registration this week, or does it depend on when it comes?
Yeah, we're not going to, Trish, we wish if we got some today, we would even start doing a small clinic tomorrow, but we didn't get it. So we'll hopefully have the vaccine in hand tomorrow. We'll probably put a link up tomorrow for some of the public opportunities for the next week. But what's different from where we are this week compared to the previous weeks is we have, almost 2.5 times more vaccines, so we can do more. We'll be vaccinating Wednesday, Thursday, Friday, Monday, Tuesday, and then Wednesday starts a new week. So, there's going to be more opportunities for the public, for sure.
How are you selecting people off the restaurant and hotel worker list?
What it is, because look, I'll give you an example why we're doing it this way, Tim. There was an executive order that the governor had for educators about that school districts had to give numbers of vaccinated employees. There was pushback. The governor then took that executive order off, saying, "I'll get that number from local health departments." I can't give them the number. I don't know who's who at the state fairgrounds getting vaccinated, right? But I can say how many educators or who work in educators out of our pod. So what we do is we work with the stakeholders to get as much broad-based data as we can for as many people that qualify from those businesses in our county, and then we try to work off those lists. So if we're asked, there's 1,500 hotel workers. I'm just making this number up. Okay, well, we got 1,500. We vaccinated 500 so far. Hypothetically, there's 1,000 left. And we work that through our plans because at some point, there's going to be new categories of eligible residents that are going to enter in, and you want to have these other categories move out being fully vaccinated. So we work with the unions out of the hotel workers, the owners who represent some of the hotels are not unionized. So you work with those owners, you get lists, and then we work through those lists. restaurants, broader based. There are different associations that have broad membership. Quickest way is you work with those associations to get those employees.
But are you prioritizing by age or comorbidity or?
They already
by-
qualify, but yeah, so if you have a comorbidity or age, you've already over 65, you've already qualified. At this point, anybody in those categories obviously will get to first, but at this point, we'll just get through the category based off of the employment.
But you must have hundreds of restaurant workers now probably ready to go.
Yeah,
Which
I think-
ones get picked first?
Yeah, we're going to go through the most vulnerable first, just like we started with there. Now they may have already gotten vaccinated, but then you'll go more to a randomized process.
Hey Ryan, with the on-list, is there some adaptability to create different rules for circumstances like this? Like if you are opening it up to people based on their workspace, can you use that on-list technology to create different rules to draw from?
Maybe, yeah. I'm sure anything's possible. Whether or not we have the time to do it, we'll see. I don't want to make any promises, but certainly on-list is going to get a heavy pull this week, for a lot of these doses. So we'll see how many people are even left on-list after this week.
Do you know how many people are on the list now?
I don't. It's got to get scrubbed through. What we find is we pull people. Many people have already gotten appointments, and so then you got to keep pulling to find the available appointments. So the list is being scrubbed for all of that. So we figure out who is still left and get to them, and then essentially, I think over the next few weeks we'll probably be through on list.
So we probably have about 200,000 county residents still to be vaccinated who are eligible, if we've done 110 by the end of the week.
Yeah, I think you'll have the adult eligible. So eligible by being an adult based off of the vaccine, you'll have so there's 360,000 adults that are eligible. We have about 465,000 or so residents, the rest of them being kids under 18. So essentially we don't view them as being eligible, even though Pfizer, I think you can do a 17 and 18-year-old. So I think if, a couple of weeks at this supply levels going in where there's more supply at the fairgrounds, more supply here, the pharmacies got more supply as well. You'll look at a situation where you might see these eligibility areas starting to quickly evolve.
And pharmacies are still limited to 65 and older?
Correct.
Last week, did you get 1,800 doses?
We did.
So this is more than 3 times as much as.
Yes. Yeah. Yeah, we did 1,800, then we did a pop-up, which I think had, 400? 500? Yes, 2,300 total. But our base allocation was 1,800. Is that my phone? No, okay. Somebody's got is that my phone?
It's the chancellor.
That is not my phone. That's somebody else's phone. I have the same ringer. Yeah. Other questions?